Hello and welcome everybody to our panel discussion for Mental Health Awareness Week. We do have a few people who are still joining the session, but we will kick off to make sure that we make the most of the time that you've all given to this. I know for many of you it'll be maybe a precious lunch hour, and we do appreciate it. So we're running a discussion this week because it's Mental Health Awareness Week, which runs right the way through the week to the 21st of May. This year, we are talking about anxiety. The Mental Health Foundation, who are our parent organisation, is the home of Mental Health Awareness Week and set the theme this year based on the research and evidence that they had got around the subject. We all feel anxious from time to time. It's a very natural response to a very uncertain world around us at all times, but it's really important to recognise and respond when we feel anxious so that it doesn't start to become overwhelming. So in the session today, we are going to be talking with a panel who represents a number of aspects of this topic around what is it that the workplace really needs to know about anxiety, and some practical solutions around how the workplace can help. So just before we kick off, I just would like to tell you a little bit about our organisation, Mental Health at Work. I'm Alison Pay, I am the MD. We're a not-for-profit community interest company. Our mission is to improve working lives by changing attitudes and behaviours around mental health. And we do that by supporting organisations to really build capability around all aspects of the mental health agenda. We've been around for some time. We began in 2015 and we've been a subsidiary of the Mental Health Foundation since 2018. We share a very important joint vision around preventative action around mental health. What do you need to know about us? What really makes us different? Well, we're tailored. We work both virtually and face-to-face, but everything we do in terms of programmes is customised to the workplace. To support workplaces to really bring the culture change that they need or that they're looking for around mental health. We're also focused exclusively on the workplace, what the workplace needs to know in order to understand mental health, manage it, and have a focus on prevention. We are skills-based, so we're really working with people in facilitated sessions to help equip them with the skills to be able to support them in their roles and have very natural, open, constructive conversations about mental health. And we're also very pragmatic. We are looking at, from a workplace perspective, what is the return for workplaces? Not just about people, but also around the financial returns, the productivity improvements that you can expect from a programme. So that's a little bit about us. If you'd like to know any more, please get in touch and we'd be very happy to take you through that. We've pulled together very interesting panel today, a diverse range of experiences that have got very specific knowledge around this topic. We have Maggie Rose, who is our head of evolution at Mental Health at Work and has always worked in mental health, has devoted her career to it, so brings a wealth around that. Shari McDade, Head of Policy and Evidence at the Mental Health Foundation, and then Charlotte Silver, who's Culture and Engagement Lead at MHaW Organics. MHaW Organics is a client of ours and has done, we know, an awful lot of work around this space. So we're interested to hear what Charlotte brings. So just to kick off the session, Could I have from each of the panelists just a quick introduction, brief introduction, who you are and why you were interested to be on this panel? And can I start with Shari, please?
Thanks, Alison, and it's a pleasure to be here. So I've been working in mental health policy, advising governments on what they can do to strengthen their approach to improving their population's mental health for over 20 years, nearing 25 years. And I've been with the foundation since 2019, working both in the London office and now more latterly in the Glasgow office. I've done a lot of work on what are the factors that give rise to increased risk of people having a mental health problem, and how can we tackle those risk factors to reduce the number of people who end up needing mental health care. And I'm really interested in being here today because, well, you know, I can say that I'm someone who has been an employee for many years. I have someone who's lived with diagnosis of anxiety for many years, and I'm someone who's thought about it in research terms and in policy terms, and I'm really looking forward to hearing from others and seeing how we can make workplaces the best possible environments for people to have good mental health.
Thank you. Charlotte.
Thanks, Alison. Hi, everybody. I am Charlotte. As it says on the slide, the Culture and Engagement Lead at NEOM Organic. So NEOM is a wellbeing brand where we use 100% natural fragrances to better boost your wellbeing, whether that's through less stress, better sleep, a boost of energy, or a lift in mood. So it's really kind of central, this whole topic, to the value behind our product. I've been with NEOM 5 years, actually, this week, and have kind of gone through various roles in my time here. But my passion for this topic is through the passion I have for our people. We're a fast-paced, moving business that has lots of different pressures at different times, and working together to really embed a culture of safety, of honesty, and being transparent about mental health as we understand it affects us all, is really key and kind of forefront to our employee strategy. So as you said, Alison, we've done a lot of work over the past sort of 2.5 years to really kind of put this as a central kind of focus for the team, and really excited to be here today just to open up that conversation, hopefully inspire others on the call to be able to put practices into place in their own businesses or way of life, and hopefully we can all kind of work together for better mental health whilst at work.
Brilliant, thank you. And Maggie.
So thank you, Alison, and I'm sorry for my delay in joining today, a tech issue, but I'm so delighted to have got in finally, because I never miss an opportunity. Many of you on the call will know that, to jump on and to talk about what has been my life's passion, which is working in and around mental health. And I think my particular celebration today is getting to this point where Mental Health Awareness Week is the most brilliant place for us to start talking out very loud about the things that we want to. And it's great to see anxiety on the cards today. So I'm really keen to share all of the things that we've learned from the workplace and from my previous roles, and where we are today with our culture and understanding of mental health issues, but also how the workplace plays the most fundamental part of helping open this agenda up and talk about it. So I'm delighted to be here, both within my role now and within my passion for my career.
Thank you, and thank you, everyone. So we're now going to go into some questions, where if you have any questions of your own, please pop them in the chat. but there also will be an opportunity at the end for open questions. So firstly, I'm going to turn to Shari. In preparation for Mental Health Awareness Week, Mental Health Foundation have produced a new report called Uncertain Times. Can you share some of the highlights of that report with us for the working age population, and on focus on some of the differences, particularly around young people? Thank you.
Sure, Alison. And I suppose one of the things to say at the start is that anxiety was chosen as a theme because when we polled people even a year ago and asked them what were the mental health concerns that they felt were the highest priority, anxiety came up on top. So it's a theme that I think the whole society in the UK is really concerned about. It's an issue that I think a lot of people are feeling. We thought that it was very timely and relevant, and that came through in the survey that we ran in March of this year. So what we found in March was that 3/4 of adults in the UK are saying that they felt anxious at least sometimes in the previous 2 weeks. And 1 in 5 adults are saying that they had felt anxious most or all of the time. So this is a feeling, and anxiety, as you rightly pointed out, isn't always a negative. It's a normal emotional response to a variety of our life circumstances, but it can become problematic. And at least 1/5 of people in the UK are saying that it is problematic for them, that they're experiencing anxiety most or all of the time. Young people came through as a really key group in our survey. So nearly all of the young people that we polled, it was 86% of the young people had said that they felt anxious in the previous 2 weeks. And really important in terms of when it tips over into being problematic anxiety, that over half of the young people said that their anxiety had stopped them from undertaking a day-to-day activities, kind of normal activities of daily life. So that I think is a red flag for us. It tells us that the young people in our workplaces, that there could be a high proportion of them who are living with anxiety that's interfering with their daily life, which could mean that it's interfering with them being able to perform at their best, in work, or a distraction from them being able to devote themselves fully to work. So that's a concern. Now, why are, I suppose, how do we know that this is becoming problematic anxiety? Well, nearly 1/3 of the population said that they were not coping well with their anxiety. So that tells us something very important. And there were higher levels. This was higher among students. So for students, it was 40% of students that said that they were not coping well with their anxiety. What are people anxious about? Well, the cost of living crisis was clearly very much in people's minds. We asked people what they were anxious about, and the most commonly reported cause of anxiety was being able to afford to pay bills. Now that was more for people higher working age. So people aged 35 to 64 were most anxious about their finances, but that it was featuring very much for people in general. Then in terms of, whereas ironically enough, the youngest age group, that is young people age 18 to 24, were less likely to be worried about paying their household bills. We can imagine maybe that there are circumstances where young people are not directly responsible for paying their household bills. Maybe that doesn't feature for them as much. But interestingly, when we asked students in Scotland about their food security, we found that many students were experiencing food insecurity, that they actually didn't have enough to be able to afford food. So we know that financial concerns are a significant pressure on the student population. We asked people about, you know, who they would tell or not tell about their anxiety, because we know that stigma is still an issue. We like to think that stigma is reducing. There is some evidence of levels of stigma reducing. And yet it was still the case in our survey that 46% of respondents, so getting towards half of respondents, said they wouldn't tell their employer about their anxiety. And a third said that they didn't think their colleagues at work would be sympathetic if they told them they were anxious. So maybe that's a bit surprising to us. We tend to see people talking about mental health more on, you know, in the media, and we tend to think maybe it's not such an issue anymore. But when it comes down to having specific conversations with people in the workplace, a lot of adults are still hesitant to do so. And that's a clear pointer to what kind of work needs to be done in workplaces. Other things that people said would help with their anxiety that were related to work, 1 in 5 said that less pressure at work would be helpful, and 14%, so what is that, about 1 in 7 said more flexibility at work would help their anxiety. So these are some of the findings from our research that focus, you know, that's the findings particularly illuminating young people's experience. I think the one other thing to draw out there is that in terms of help seeking, you know, this is something that we really want to encourage anyone who's experiencing anxiety that's interfering with their daily life. And we want to encourage them to seek help. And in our research, young people said that they were more likely to seek help from their friends than from a medical professional, like, you know, from their GP. It wasn't much in the difference, but it is worth considering. How do we encourage young people through workplaces? How can we encourage young people who are experiencing unhelpful levels of anxiety to actually reach out for help more?
Yeah, that's really interesting, Sherry. And I know you're going to put a link in the chat for anybody who wants to look at the report in more detail. But just to kind of follow on to that, I'm interested to hear from you. How does the experience of young people maybe contrast with some of the older generations, the Gen Xers and beyond, who we know are still you know, very much part of the workplace?
Yeah, that's a really good question. In the workplace and beyond the workplace. So the levels of anxiety for people in the working age population were fairly high for all age groups. So for example, for 50 to 64-year-olds, the proportion who said that they had experienced anxiety in the previous 2 weeks was 76%. You know, and that was not so far off of the 86% of the youngest age group. The group that was least likely to experience anxiety were those age 65 and over, and they're just 29% of that group said that they had experienced anxiety in the past 2 weeks. So that is interesting and warrants further investigation about why it is that the working age population experiences anxiety, and then that there's this drop off for the 65 plus age group.
Yeah, that's really interesting. I think from, you know, for the workplace, you know, if you are you know, you are more likely to experience anxiety than not. And, you know, it's clearly a really important topic for the workplace to look at more seriously.
The other one thing to draw out that's really interesting is how that age group, the older age groups, were more worried about finances. They were more likely to report financial concerns. And I've speculated about this. It is only speculation, but that the cost of living crisis had brought a sudden jolt to people who may have been planning for their financial future for many years. And the closer you are to retirement age at this point, the less likely you have to be able to change your financial planning for retirement. So I speculated that might be why the older working age group might be feeling the financial pitch more. And that's also something that we need, you know, when we're looking at our workplaces and who might be affected by anxiety, it's really important to explore that in a little bit of depth, to realize that there might be different factors affecting different parts of our workforce, and to explore that with them and be able to provide a variety of supports for people.
Thank you. Thanks, Shari, for that. So moving on to Maggie, with 3/4 of our UK population saying that they have felt anxious in the last 2 weeks, what guidance can these statistics give us in the workplace, and who are we seeing is really at risk?
Okay, well, the 3/4 is such a lot. Let's reverse it, that only 25% aren't stating that they're experiencing some form of anxiety. I loved some of the things that you covered, Shari, because it's interesting about the age groups, and it's really interesting from a research point of view and for an information point of view. I think the general message from our point of view is no matter what the age group, we've got elements of different reasons for anxiety behind the experiences. And I think a big factor in this is work. Maybe for the younger people, are they going to find work? Are they going to engage in work? Is it a 0 hours contract? Are they going to have any security? And quite possibly when we're getting to the age of 65, maybe those people aren't experienced so much about workplace anxiety, but about financial anxiety. So I think the key is here, it's probably better to say everybody's at risk. So I think those statistics are very high. And the other thing that I most appreciated, Shari, was your suggestion that really we hope that we're getting a long way with stigma, but actually, are we? You know, are we really? Because we're still hearing the same things now, and certainly Jess, who does quite a lot of our media research, you know, the suggestions on there are still very disappointing. So days like today, we need to step up and say, right, let's talk about it all the time so that we can talk about it and then do things differently. So I think it's fair to say that we're all experiencing pressure and stress of some kind. What was the second part of your question, please, Alison?
I think just what guidance does this give us for the workplace?
I think the guidance that it is particularly pointing to is awareness. I think we can't do anything unless we really examine the culture of organizational life itself. Are we open? Are we as open as we could be and should be to the fact that we need to be looking at individual needs? And I noticed that Nikki, thanks for your question in the chat, Nikki, and you're looking at undiagnosed conditions such as ADHD, and you're asking, what do you think about it? I'll answer for myself at Mental Health at Work. I'm thinking a lot about it, because we're only just stepping in to the fields of joining the dots and realizing that certain conditions, whether they be mental health issues or whether they be neurodiverse issues, have very individual needs. And I think more and more, everybody is looking more to the workplace for support. We are looking to the workplace for having a little bit more knowledge and information about our needs and about reasonable adjustment around those needs so that we can all work productively. So I think that these are messages for us all. And as we go on with our hour today, I know we're going to talk a little bit more about specific things that the workplace can do. Sorry, put my teeth back in. That's
Right,
me.
thanks,
Thank
Maggie.
you.
And I think that moves us really neatly on to you, Charlotte. We know from our work with NEOM that you have got a younger demographic skew within your working population. So maybe you could tell us a little bit about what the issues are that you see within the organisations that are really prompting anxiety and how that differs across different groups in your workplace.
Yeah, I mean, first of all, thanks, Shari and Maggie, for your points. I think when you're looking at this in silo of your own organisation, it can feel quite overwhelming to tackle these issues, and without actually hearing the research and the fact that it's a common kind of statistic across the UK and globally. It's odd to feel like that's almost a comfort that you're no different to anywhere else. So yeah, thank you so much for kind of all your insight. So yeah, our kind of biggest age demographic across NEOM is between sort of 25 to 34, so predominantly within that kind of Gen Z millennial group. And I think there are many different issues that can prompt anxiety between these two groups, in and outside of work. Many, that we've touched on already, but I've seen them become more and more aligned actually since the pandemic. It's no shock that I'm sure we all had a spotlight shone on our own mental health during this time, and we became more and more aware of how we deal with isolation, the need for communication, the need for connection, having validation of our success in work when you don't have those conversations within an office space, and trying to kind of really create that openness on our own anxieties. And for me, the kind of centre of that was the realisation of how our personal and our work life integrate. And at times probably morphed far too much into feeling like one thing. And there's always that kind of common phrase of work-life balance. And I think there's also an argument of how can you have them in balance? And there's pressure on having that kind of balance. So as many businesses move towards hybrid or remote working, permanently, I really feel passionate that kind of focus needs to remain on how we support employees through this change, because although we're nearly 3 years on since that dreaded time, there's still that shift. There's still that navigation to kind of work through in how you deal with that. I also think that the current cost of living crisis, we can't kind of shy away from that, is having a really big effect. And although, yeah, the research, and I know you said you sort of speculated that maybe that financial anxiety is coming in the kind of older generation, I think the kind of crisis of the housing market is a really difficult one to navigate at the moment, with kind of many probably of expecting to already been at that stage to get on the housing ladder and secure their finances in this way. But, current inflation rates, and I think even last week, the Bank of England increasing to 4.5%, it's becoming more and more difficult to achieve, which means, higher living costs in rent, and, that kind of added pressure of value for your income. 35% of our head office team actually live in and around London, where the cost of living was already high. So it's adding more and more pressure to the workplace, because employees want to progress, they want to secure their position, they don't want to move around as much, and secure their roles and future. And I think traditionally we see the Gen Z generation become really, really ambitious and feel more comfortable in setting boundaries. They seem to be more aware of their mental health, having grown up in a generation where this conversation was more at the forefront in comparison to millennials and generations before. And I think the benefit of this in a brand like NEOM, which I'm very aware that we are very lucky in the fact that this aligns with who we are as a brand. And I know it's sometimes difficult to even get the conversation started in kind of different sectors. But we have a team who react really positively and feel comfortable talking about wellbeing and mental health practices. And you know, the things that we put in place, you know, they identify with the positive feeling of being healthy at work. And I think that for millennials and Gen X and boomers, this has been quite a shift. You know, traditionally, that value of work was separated by probably just job role and salary. You know, am I satisfied in my job and does it pay what I need it to pay? But now there's so much more that we all consider in wanting work, you know, mental health support, development, learning, culture, flexibility, child support, you know, really being able to have that work-life balance or try and achieve it. So, you know, I think you start to see this on the TikTok content that showcases the different approach in Gen Zs, and they're being branded to be more relaxed and setting their ways of working, and other generations are feeling guilt and not getting through the to-do lists or prone to working over their hours, less likely to be upfront about personal issues that may affect work. And I don't think there's any right or wrong with either approach, but facilitating a culture in the workplace that can support and encourage an open approach to both, you know, is really key, whilst ensuring that you can see that productivity. But just being aware of how easily those boundaries, you know, can slip. I think the other thing to sort of bear in mind as well, you know, NEOM, we're 95% of us identify as women, so we're quite a large group of powerful, independent and creative women, and it's empowering to be around. And it almost can be too easy in my role to find the obvious initiatives that I know will connect to the team. So it's really important that we do focus still on the sort of 4% of men that we have, because we know mental health statistics in men can be a lot higher, and you know, that kind of stigma around not speaking is still very much there. So you know, encouraging to see this, it's really encouraging to see this at the forefront of campaigns across social media, and really kind of sure that all of us sharing that content around kind of male mental health is you know, just as important in this conversation. So yeah, so we have an approach at NEOM where we all have mental health that needs nurturing. Our initiatives are, you know, inclusive for all, optional in some cases. You know, by no means is this something that we make compulsory, but we have a few things at a minimum that are expected practices that better our mental health and anxiety levels at work. And I'll you know, touch on those later, but we do also need to focus on specific issues. And I think something that is an unsaid conversation is around kind of menopause at the workplace and how that changes behaviour and creates anxiety and new kind of feelings that people won't have experienced. So it's an ever-changing conversation, and something you kind of really have to keep on top of to be able to hit the needs of each of those kind of age groups.
Brilliant. Thank you, Charlotte. It's really interesting and insightful. And what particularly strikes me is, you know, you recognise there isn't one size fits all. It's not one thing and kind of everybody's going to be happy. There might be different things for different parts of the workplace. I'm interested to hear a little bit more about how you've started to address this broader discussion within NEOM and impact really some of the issues that have been raised amongst people.
Yeah, so I think, you know, pulling back to how our marketing teams and social teams speak to our customers, you know, it really takes that stop motion just to say, right, so then what are we doing for our team? We talk a lot about building your own sort of wellbeing toolkit and that kind of go-to thing that works for you, whether that be a relaxing bath using, you know, one of our products, then lovely. But it's just that, what's that time out for you, and encouraging those practices of getting outside in nature for a walk. And we did a sleep study last year all about how sleep can affect your sort of mental health and well-being. So I really try and kind of mirror whatever the storyline is to our customer to make sure that's kind of in place for our team. So this week, actually, we launched a new calming pen, which is a roll-on sort of de-stress pen. That was kind of everyone's staff allowance. We're bringing that into our conversation this week. And actually, we've got £5 of that is being kind of donated to the Mental Health Foundation. So it all kind of really, you know, links in so that people feel that kind of connection. But then the kind of more specific things that we've put in place, very much based on the feedback from focus groups that we did with mental health at work. You know, it was a reactive kind of way of dealing with that feedback. Was we implemented wellbeing days. So we give each of our team 4 wellbeing days a year. You know, it's a no questions asked, book that time off, whatever you do with it is your business. You know, and it's just that reset time to get yourself into a better headspace, whether that be at the end of a busy period, after a really tough day. There's you know, that flexibility in the way that you can use those. Opportunities to volunteer as well. So we also give people volunteering time. And although that's something that I think so many people have the best intentions to do, and you see it in your diary and you go, oh, can I make that time? When you do it, the give back that it gives you, and the feeling of kind of getting outside or working with people and helping your community is amazing for your mental health. And until you do it, you really kind of don't know the benefit. So that's something absolutely that I would kind of encourage. And then, you know, Mental Health Awareness Week, although we try and discuss this throughout every week, we put together an event schedule each year for our team. So yesterday, we kind of got a kind of social committee, I guess, from different departments. They put together a guide on podcasts around mental health and sent those out to everybody just to sort of put that on instead of the radio and fill that background noise. Today we started the day with a yoga session actually taken by kind of our head of finance, who is in her spare time a yoga instructor, which was a lovely day. I think many people from the team are on this call as well. And then, you know, we kind of join with our partners. We've got another session Thursday morning with Susie Redding to speak about kind of that toolkit of anxiety that you can do, and balancing that with things like time outside in nature and feel good workouts and things. So it's quite easy, you know, to kind of put something together that's just a touch point. It's not too much time out of people's day, doesn't affect productivity, but it's just opening those kind of options of kind of conversation. And then, yeah, the most recent thing is that we've trained 12 mental health allies. So we're using this week as an opportunity to launch ourselves into the business with a guide of kind of what we're there for and how we can be used. And yeah, we've got people from across all levels, from director to, you know, marketing executives to heads of. So it's a really nice approach that we've taken to have that option across every level. So yeah, there's just those small things that make a massive difference, I think, for people knowing that they're there, whether they use them or not. But it's just the fact that, you know, as Maggie said, there's more pressure for the workplace to support mental health and to have signposting, and that might not be a benefit you pay for, but, you know, just speaking to somebody and opening that circle is really key.
That's brilliant. Thanks, Charlotte. And I think one of the things we're often asked is, well, what do you mean by signposting? Because it's not just EAP or health benefits. You know, as you've mentioned, you know, it can be podcasts, it can be books, it can be, you know, other resources and charities, of which there are many. We do produce a few signposting guides, which we use as part of our client sessions, but we've also created some adaptations of that for broader review. So Joe, it might be useful in the chat adding in the links to our signposting guide, certainly for financial anxiety, which somebody I think I'd seen earlier in the chat has asked for. Thank you. So Maggie, I'm going to move on to you now. We've heard a lot about the different populations within the working age category, their differing concerns and needs. We can't cover everything in a short session such as this, but we are hearing more and more from our clients around interested to understand more about neurodiverse colleagues. So my question to you really is, what can the workplace do to improve support and understanding for neurodiverse colleagues, just to be more inclusive and person-centred?
Thank you. I think This is a very big question, and it's a question that a lot of people are not ready to address at the moment, because I think the question that comes before that is, does your company really foster an inclusive environment? Does it honestly foster that? Because that's the pillar that we need to spring from in terms of any other inclusivity and diversity questions. So I think it's about three things. That it's about your own needs. What do you need in the workplace? It's about how you work in the workplace, and does the workplace understand that? But it's about how inclusive is the workplace that you've chosen to work within. And so I think there is a bigger question. It's a question for people to really take away today. How inclusive is your workplace? And who are you missing in that answer of yes and no? Because we have to be ready for learning. And I noticed that, sorry, it's quite a lot of chats back, but is there a Mr. Potter, I think, on the call, saying that it starts with education? And yes, it does. However, before we start with education, are you ready to listen? Because otherwise education doesn't quite do it. And we've learned that over the years, because we're still talking in so many ways about very basic things. So I think that, yes, we need to attend to it. What does neurodiverse mean to you? And how much can you embrace the needs of individuals and truly understand that from the point of recruitment? So I think that's my answer, really. It's about the culture of the organization. And I think it's, in order for people to really excel, and I'm looking at human sustainability at the moment as a very powerful pillar for our organizational cultures. And in order to sustain as human beings within the workplace, we need to be able to express what we need and how we work. So that's my answer, really. Check yourselves out. You're on mute, Alison.
Thank you, Maggie. As always, very practical and informed and realistic, and making sure that we do start in the right place to make the progress that workplaces need. Shari, just coming back to you, what do you think we can really learn from both the workplace and workplace experience and the research about what workplaces might be able to do to support?
Sure. Well, I mean, I think that the first message, we did a report where it was actually that the work was carried out by the London School of Economics, specifically to look at what are the cost-effective interventions for preventing mental health problems, because we know that this can be quite an important focus for decision makers. How much is it going to cost, and will we see a return on that investment? And what they said was that a combination of providing rapid access to psychological support alongside creating a mentally healthy workplace is cost effective. So it's actually going to, you will recoup any investment that you make when you do that. And it's very, I think it's very much like what I heard Charlotte talking about in terms of creating that mentally healthy workplace. There's no kind of single thing that you can do. It's going to be a real combination of different types of awareness raising, education, supporting line managers, supporting and engaging with line managers is absolutely critical to creating an environment where all employees feel valued. And of course, that means line managers themselves have to feel valued and empowered and supported. But they play such a crucial role in setting the tone and that day-to-day interaction that they will be having with staff whom they supervise. but there are the other levels of it as well. So for example, I'm very strongly of the view that leadership, that leadership at the highest levels in terms of talking about mental health in the workplace is really important and valuable. I think it makes a difference if a leader of the organization can say, yes, I've struggled with my mental health, and these are the things that I do every day to try to stay well. And that in itself opens the door for other people in the organization to have that conversation. But the research that LSE did, it did highlight the importance of having some quick access to kind of early intervention support for people who are starting to feel distress as well. And that can so help to prevent issues that are maybe in the early stages. You know, anxiety is just starting to interfere with you being able to focus at work, and catching that before it gets embedded into an enduring mental health problem that would require clinical intervention. So I think the two or three things there that go hand in hand, you know, to create an environment where mental health and talking about it and receiving support and reaching out for support, and the whole environment of the workplace is one that supports people's mental health. And I think that's the kind of workplace, and you'll get the best out of people.
You know, it is often that early intervention with a view to prevention is so critical. And, you know, certainly our view is that starts with a conversation. And it's just another reason why weeks such as this are so important. It's not just that we talk about mental health in Mental Health Awareness Week, but it reminds us and prompts us around, you know, in a busy working world, around what that conversation can be about, how you can do it, who you might involve as part of that. So we're running into the last 10 minutes of the session. So just a final quick question for our panelists. Charlotte, what do you think the major takeaway from Mental Health Awareness Week is for the workplace to really start now?
That's a great question. And I think we've started to understand that it's not one approach for all. And I think the first thing you can do is, you know, the theme of this year, if we keep it kind of on that topic around anxiety, is take the time to understand, you know, what anxiety is, how it's different for all, open that circle, discuss that with your team. You know, there's such a spectrum of how anxiety can affect an individual. And you know, that's the point. It is individual. Some people, you know, are unable to come to work when they have an anxiety attack. Some just feel it, you know, during the work and will say, yes, I feel that makes me feel anxious. And it's putting all those things in place so that as a workplace, you understand how anxiety affects people, which takes time, obviously, like I say, because it is individual. But there's a few, you know, easy things that you can put in place that can be that can help sort of facilitate that. So creating that space that truly feels like it's accepted and understood. So yeah, I would really sort of start by understanding what works for your organization that doesn't affect time and productivity and all of those things that we can get caught up with. Looking at it on an individual basis, so starting to bring that into one-to-one discussions and open that conversation, just by saying, hi, how are you? And asking again. You know, it doesn't have to straight away go, and do you suffer with anxiety? Just start to ask, hi, how are you? Off the work topic, and see how people open up, and you can kind of go from there. I've just noticed there's quite a few kind of comments in the chat around what you do if your SLT or your kind of high execs don't buy into that. And, you know, how do you get that feedback? And I would say the most positive thing is and it's a scary thing to do, and I did it, but is to give them the feedback of their team. So start with the people that want the conversation and the people that want to create that action, and take that feedback upwards. And, you know, it may be that you're opening their eyes to the things that are in place, that are not in place, that they maybe think that there is. They may think they're very inclusive and that they've got this great kind of culture, and you're sort of saying actually people don't feel that way, and that shock factor may kind of start the conversation. So that's kind of what I would encourage.
That's great. And you might need to go to different people with different messages.
Yeah.
We're really fortunate now, there is a whole, for whoever you are talking to, there is a message about why this is the right thing to do, with some evidence around it.
Absolutely. And, senior people have data. So if you can give them a good statistic, say X% of the team actually don't feel this way, or do feel this way, or are happy, they can kind of go with those practical elements and hopefully get some action.
That's great. Thank you. Maggie, the same conversation, the same question to you. What's the big takeaway for this week?
Okay, I'm going to make it short and sweet because I can see this time ticking. So I've condensed it into some questions that you can ask yourself. And that's a great question to ask yourself around the topic of anxiety, and around the topic of whether or not this is very predominantly workplace anxiety. So the question is it me or is it you? So try to define where the anxiety is really condensed. The next thing is tips and signposting are fantastic, but they're not enough. They are not enough to signpost somebody and think that you've done the job. There is nothing to beat that conversation and that engagement with the individual. And the other thing is to ask yourself what I asked earlier on, please really seriously ask if you are working in a fully inclusive environment that is open to this conversation and to making positive change around mental health in the workplace.
Brilliant. Thank you, Maggie. We've heard some fabulous insights today. I hope that's kind of really helped everybody around broadening understanding of a topic and kind of grounded us really. We heard that nearly a half of young people are impacted by anxiety every day. It affects their everyday actions. That's really significant. And 3/4 of us have been anxious in the last 2 weeks. We've heard there are many routes for support, friends, workplace, signposting. I think Maggie's kind of really summed that up now, about there is nothing beats the conversation. And we can all ask that question, how are you? But most importantly, stop and then take the time to listen to what the answer is. We've also heard that this is not just one thing. It's not just one size fits all. There are, organizations like ours spend our time trying to really get under the skin of organizations, departments, functions within organizations, to try and answer that in different ways so that we really do change behavior and have that impact around people and their working lives. So we're coming to the end of the session. I've just put up our contact details here if you'd like to find out anything more about us as an organisation. Contact or email us. If you email us and you want to talk to anyone else in the team, we'd be really happy to put you in touch. We've recorded the session today and it will be loaded onto our website without any of the chat, so it's just the panelists speaking. It's none of the discussion around that. Thank you very much for coming along today. I hope you've enjoyed it, and look out for the rest of the activity during Mental Health Awareness Week. Thank you.